Hi, I'm David Ferris, President and CEO of the Rocky Mountain Area Chamber of Commerce. And today we're celebrating, it's hard to believe we're celebrating, we're in spring, we're celebrating it's April, we're celebrating this is your 4th anniversary.
Yes.
And we're here today at NUTRADRiP IV Hydration and Wellness Clinic. And Dr. LaToya McCurdy is with us, and we have a special presentation as she is the Rocky Mountain Area Chamber of Commerce Small Business of the Month for April.
Thank you.
And congratulations.
Thank you so much. I appreciate it.
This is, as I stated earlier, this is the 4th year, if I'm not mistaken.
Correct.
And you had celebration earlier. And she also joined the chamber 5 minutes after she put the key in the door and turned it, I think. And we thank you. She's been a great supporter of the chamber and of our community, and we're so proud of you and proud of your growth and your success.
Thank you so
And I think
much.
you're an inspiration to a lot of entrepreneurs, and we do thank you.
Thank you.
Michelle Tuning, who chairs our small business committee, is with her mother today. She had to take her to, I think, a doctor, and she sends her best.
Thank you.
But I know you've got a few words for us of encouragement.
Coming from Rocky Mount being my hometown, I always like to make the statement that I'm so grateful and thankful that the community has supported us in our endeavors. We opened, of course, 4 years ago during the pandemic when a lot of businesses were actually closing or not doing as well. And we have been successful and continue to thrive with God's help and the support of our community. Each and every year we've gotten bigger and better, and we're just so appreciative of the community. There is no NUTRADRiP without Rocky Mount and Eastern North Carolina. So thank you all so much for coming. It really warms my heart. I'm not a crybaby, so I'm not going to cry. But thank you so much. It's always good to be recognized for the things that we're able to do. Not that we do it for recognition, but it just always feels good when you know that you're making an impact and people are noticing. So thank you so much.
Dr. McCurdy, one more thing before we let you go.
Mm-hmm.
When somebody pulls up at 4049 Capitol Drive,
Yep.
What can they expect in your clinic?
They can expect a transformation of their life, so a life change. At NUTRADRiP, we transform lives and we let you meet your best version of yourself. So if you are ready to be introduced to the best version of yourself from a health and wellness standpoint, please come to NUTRADRiP. Call us and schedule an appointment at 252-443-3550.
And what?
We are really happy to get to know Dr. LaToya McCurdy today, and you're from here, right?
I am.
And came back home, and we really appreciate that you came back home. I read the article about you in the Telegram and was so glad as I read it to really learn what a true entrepreneur you are.
Thank you. Thank you.
You've had a great background training you worked at the hospital for a while, you worked at Eastern North Carolina Medical with Dr. Crocker for a while. You lived in D.C. for a while. Kind of trace some of that, and then what brought you back to Rocky Mount?
So I always knew that I wanted to practice here. This is where I'm from, where my family's from. And so I went to graduate school at George Washington University, which is what got me.
Great school.
Yeah, which got me to DC. But then I did my clinical rotation while I was in the nurse practitioner program. I did it here, and that's when I was introduced to Dr. Crocker. And so before I even finished my rotation, he's like, when you finish school, call me because I've got a job for you. And he was telling the truth. Before I even took my board license, he called me one night. I was like, I'm ready to come to work. And I said, well, I haven't taken my license test yet. And he said, well, what are you waiting for? Go ahead and take it. So I did not get any time off. By the time I graduated, I took my board test, passed them, thank God, because everyone would have known if I didn't. And I started working at Eastern North Carolina Medical Group, and that was 2017.
Wow. And you are a family nurse practitioner,
Yes,
which is
ma'am.
master's level, but then decided to get a doctorate.
Yes, ma'am. I am a lifelong learner. I'm really a geek to the core. So I'm always interested in learning new things or just expanding my knowledge, adding on additional skills. And so I felt it was, necessary and important for me to get that terminal degree, and be able to have a background in research and have the opportunity to do that. And so really a part of that was infused or implemented in NUTRADRiP. My research at East Carolina University excuse me, was focused on obesity management and weight loss in primary care and behavioral counseling. And so we actually implemented the findings and the study that I did at East Carolina, implemented it in NUTRADRiP. And so it's been very successful with our weight loss program.
Mm-hmm. And you worked you've got a small primary practice also. Tell us about that.
So New Regional is NEWH. I always tell everyone the H is silent. Is for Nash, Edgecombe, Wilson, and the Halifax counties. And so we provide primary care, family medicine services as well. When I transitioned from Eastern North Carolina Medical Group to NUTRADRiP, there was a gap in care for some patients, of course, in our area, and I'm sure you're familiar with it. And so we opened a small primary care office to help serve that gap or help close that gap.
Where is that located?
So it's actually located at 4049 Capitol Drive. It's facilitated, in the same office.
Good. And Dr. Manuel is the physician. When you do something like that and you're not an MD, you have to have oversight, so to speak.
Exactly. North Carolina does not have full practice authority, but it is something that we are fighting very hard to obtain. But as of now, I still have to have a collaborating physician. So we have to have an agreement that basically if there's anything in need, whether it's advice or issue, that I have a physician that I can contact. So she doesn't have to be in the office or even practice in either of my practices, but we have to have that agreement, that collaborative agreement.
You're an entrepreneur, and I really like that people are watching this, because hopefully you can be an inspiration to others. And in reading about your background, you accessed Nash Community College's small business resources. Tell us how that was beneficial.
Oddly enough, I had a family member who has a cleaning service, and so she contacted me one day, and we were just talking on the phone, and she said, she needed some business guidance. I said, well, Nash Community College does some seminars and things like that. So we both signed up, because she wanted me to do it with her. We both signed up for Launch Rocky Mount. And so previous to me starting it, I had went to California, and I saw these drip bars, and I didn't know what they were. And so my friend that I went to see in California, she's like, oh, when we party and we're hungover, they have IVs and they're mobile, and you can get an IV and they'll, help you bounce back. So when I started Launch Rocky Mount, I wanted to do IV therapy, but not from the angle of hangovers, but from a health and wellness standpoint. And so I did the Launch Rocky Mount program, and just learned so much. I learned so much. I tell people all the time, my background is in medicine, not in business at all. So I, talk to me like a brand new person. And so I learned how to do a business plan. I learned so many things. They helped me consult with lawyers and accountants and marketing, all the things, because of course in healthcare there's a lot of red tape. And so NUTRADRiP was birthed.
That was a big leap. I mean, financially and everything, to leave a stable employer and come do this. So congratulations.
Thank you.
Maybe down the road, some other people who are watching can think, they would love to talk to you about having the nerve to do it and the skill set to find a niche to do it. So, and I think you're on the board of trustees now at Nash Community College.
I am on their foundation board. Yep.
Good.
I'm on their foundation board. And actually, when I opened NUTRADRiP initially, it was part-time on the weekends. I still worked full-time at Eastern for about a year. And then as the practice grew, I transitioned into full-time in the NUTRADRiP and was able to hire staff and so forth.
That's probably a real good idea for people to not leave their lifeline and just jump straight into something.
Yeah.
Is NUTRADRiP a franchise, or is it a name that you came up with?
It is a name that I came up with. I still have the notebook paper where I had written out like 10 names, and then I circled NUTRADRiP and we went with it. Actually, my mom and my son helped me come up with that name. So, yep.
And you said it's not strictly for, like in California, for people who want to get over at nights when they had binges and whatnot. How does somebody know if they're deficient in some nutrients or vitamins such that would help them?
So you can do laboratory testing, but oftentimes most patients were either deficient in vitamins, and studies show that 80% of patients have some type of vitamin deficiency, or should I say 80% of Americans either dehydration or actual vitamin deficiency. And so it doesn't require that you have lab work done to get an IV infusion, but if you'd like to have testing prior to, we can.
And do you mix up the cocktail of what you give them based on what you think they need or what you see that they need?
So we have our popular infusions, so like our Energizer for energy, we have an immunity infusion to help boost immune health, but then we do have a customized IV infusion specifically for patients who, they come in, they tell us their symptoms or what they're experiencing, and then we add the vitamins and minerals, and we call that our build-a-bag. So it's customized specifically to your needs.
Well, it's really good you know what to do, because there's some of those nutrients that are vitamins and minerals that you can get too much of, and so to have oversight by a healthcare person is really important in that.
Exactly, most definitely. And then of course some vitamins are water soluble, some are fat soluble, so some can be infused and some can't be infused, so that's important to know as well.
And do people come in here and they get the infusions in the office and then they leave?
Yep. And so we are a medical practice, but we try to have more of a relaxed therapeutic environment. So when patients come in, there's recliners, we have heat and massage, we have TV that they can watch as well, or listen to soft music, just so they're relaxed, so they get that almost self-care as well while they're doing something to help improve their wellness.
Well, and speaking of the wellness, I noticed also that I read that you do a lot with weight management and really helping people. And obviously, you take good care of yourself. But that's something I noticed that when I was on the hospital board. We really have a lot of people who don't know how to take care of their health, and they have a lot of medical problems, diabetes and heart issues because of that. Is that a passion of yours to really get in and help people?
Most definitely. Oftentimes when we see patients who suffer from obesity, they may have additional borderline hypertension or pre-diabetes. Oftentimes if we treat the obesity first and we're able to remove them from that obesity classification, we see improvements in blood pressure and A1Cs for diabetes, improvement in cholesterol. And so if we're able to address that, then oftentimes we can improve so many other of the chronic comorbidities that they have. My goal is to bring more awareness to obesity. That it's not, it's not just an inability to be disciplined, not to eat a lot. Obesity is a chronic condition, just like hypertension, diabetes, so forth and so on. But society sometimes puts a stigma so that patients are almost embarrassed to receive care, for weight loss. And every patient that comes through our door, we share with them in our weight loss program. We're not coming from a place of vanity at all. It's not because you should look a certain way or anything like that. It's strictly for your health, your overall health and well-being. And we know that even losing 5% of your total body weight, if you're obese, or whether you're obese or overweight, has a significant improvement in your health. We know that obesity is associated with heart disease, diabetes, even certain cancers are associated or have a higher risk if you're obese. So
and wear out your joints.
Exactly. So even being able to, lose that weight so we're no longer obese, it improves your health and reduces your risk for stroke, heart attack, diabetes, cardiovascular disease.
Dr. McCurdy, I like that you don't pass judgment, that you're all about quality of life for people. I know at the hospital when people were going to ICU with COVID, so many of them, or the majority of them, were significantly overweight. And that can really hurt people, can't it?
Most definitely. I had several patients myself who, besides obesity, did not have any other real chronic conditions. And when they contracted COVID, their outcomes were they were less than favorable. So, and it was the demise of some of them. So yeah, we see how obesity plays a role, in our life and in our overall health. So it's not just, I'm overweight, and so from an aesthetic point, I'm too big. It's not that at all. We come from a place of health, and we want to transform patients, and that's our goal, to help transform patients into the best versions of themselves, improve overall health and wellness, and then also improve health literacy throughout the community.
Do you use some of the injections if you think somebody needs that to help with weight loss?
Yep, most certainly. So when we do our medical assisted weight loss programs, we do a
comprehensive set of blood work. We do a thorough background and history. And oftentimes we collaborate with the patient's primary care provider. If they don't have a primary care provider, we speak to them about the importance of primary care and prevention as well. And then based on each individual, based on what their needs are, we develop a comprehensive weight loss plan. So some are injectable, some may be oral medications, some may be just behavioral counseling, and then some are, a combination of it all. We look at thyroid function. So not only with just weight loss, we definitely entertain metabolic health and metabolic function. We know that plays a role. Hormone function, especially in our women who are menopausal or perimenopausal, that plays a role as well. So we address the overall picture so that we have a comprehensive plan and we're not just putting a Band-Aid over something.
Good. And I bet people are very comfortable talking to you, aren't they?
Yeah. Yeah.
Okay, you have gotten more into aesthetics, and we're sitting in front of a hydrofacial screen,
Yes.
a comfortable chair, as you talked about. You got very comfortable. Tell us what you do for aesthetics here.
So we launched our aesthetic brand, which is NUTRADRiP, and so we provide advanced medical grade aesthetics and skincare services. So Botox, different neurotoxins, as well as dermal fillers that help with contouring and structuring of the face. We do liquid lipo, which helps permanently kill and destroy fat cells in localized areas. And then our hydrofacial, I think that's probably one of my favorite. It is a hydrodermabrasion, so it's a facial, and it uses vortex technology to basically open your pores up, wash out all the gunk, and then infuse antioxidants and nutrients and peptides into the skin, so that we're able to have that beautiful, youthful glow.
Are you seeing that that's catching on quite a bit here? Because there are not a lot of areas here in this area where people can get that done.
Yes, most definitely. When we launched, we did a soft launch prior to our official launch last month, and so we fill our books pretty often with the hydrofacial, and so it's our platinum hydrofacial is an hour-long facial, and so we do lymphatic drainage, we do LED light therapy as well. So it's really pampering yourself while improving your skin.
And what does LED light therapy do?
So it helps penetrate not only the epidermis but the layers under the skin. So whenever we do a facial or anything that we put on our skin, we want it to be absorbed. So it helps increase the absorption of the products that we put on our skin. Yep, it helps reduce inflammation as well. It's multiple things that light therapy can do.
You do a lot of volunteer work too.
I do.
Tell us about some of that, because I can tell you're very passionate about that.
So being from Rocky Mount, like I said, when I was in DC, I moved back here, and I always knew I wanted to practice here. So a lot of things that we do, I go to different churches in the community and speak about chronic conditions that are, prevalent in the area. I do blood pressure drives. I'm a part of Delta Sigma Theta sorority. And so we do a lot of community outreach as well through the sorority as well. But my goal is to not only improve outcomes in the community, but improve health literacy. And so oftentimes patients aren't aware of what health literacy is. And so the first thing is defining it. It has nothing to do with whether you can read or write, nothing to do with your income status or, any of that. It's basically being able to understand your health and what you're doing to your body and how it benefits your body. So do you know what medications you're taking? Do you know why you're taking them? Do you know why we need to prevent certain things? Are you familiar with that? So we want to be able to make sure that patients are able to advocate for their own health, but also understand their state of health so that they can make informed decisions about their care.
Do you have any coming up soon?
So I will be in May. I believe it's May. I don't have the exact date in my mind right now, but at the South Rocky Mount Community Center, we will be doing a physical and mental health community awareness drive. And so the theme is body, mind, and spirit. So I'll represent the body piece of it. So anyone's welcome to come. It's open to the public. We're really targeting underserved communities. So we're in South Rocky Mount, but it's not limited to South Rocky Mount. So anyone can come. And I love being able to talk and meet different people and just inspire them and let them know that it's okay if you need help, or if if your health isn't where it needs to be. There's people and resources out in the community that can help you.
Dr. McCurdy, you're celebrating 4 years of being here, and I'm really excited about the future because it sounds like you listen to what people say they need and add on those services. Is there anything that you have planned for the future that you want to share with us?
So there's a couple of things. I do want to add additional services. One thing I have considered is like cryotherapy. I think that would be something that would be lucrative here. We have a lot of athletes who come and do our Athletes Avenue, which is our line of IV infusion specifically for college and high school athletes. And so cryotherapy is something that pairs very well with that. And then
For people who don't know, you want to explain what that is?
Cryotherapy. So cryotherapy is freezing temperatures, and so you're only in a cryotherapy tank for a short period of time, but that freezing temperature helps increase blood circulation, so it can help with muscle fatigue, muscle pain, joint pain. So all the things that people who condition their body kind of aggressively on a regular basis, it can help improve. You don't have to be an athlete. We have patients who may have like chronic joint pain and things like that. Cryotherapy can help with that as well.
Can you target just one area is it like an ice bath, right?
Similar to an ice bath, but at least as you know, it's more so like nitrogen that's used versus the actual cubes of ice to cool the temperature. So we would have a full tank, but there are some devices that can target one area. So there's even like cryotherapy facials that you can just do it for the face as well.
I read in a magazine, it was an airline magazine, that the top surfer in the world every day, he gets in an ice bath. And he just totally builds up his immune system by making it fight for that. And there are a lot of people who talk about it, but I think it takes a pretty tough person to really commit to doing it.
It does. And usually it's only a few minutes, and even though a minute or 2 or 3 doesn't sound like a lot, but in order to be able to tolerate it, so you start low and then patients work their way, they build their tolerance up to maybe 2 or 3 minutes.
Are you going to demonstrate? Maybe your son. You've got a very talented son.
I would demonstrate. Actually, I've done everything that I offer here.
Good.
Everything that we offer here. Me and or my staff and my parents and family who have been guinea pigs the whole way through. So yeah, we always like to not only give information about what research shows and what clinical trials show, but also being able to give that personal experience. I've done this and this person has done this and this was my personal experience. So it usually, parallels or aligns with the clinical studies as well. So it makes patients be able to trust the services that you're offering.
Definitely, if you say, I've done this and I'm comfortable with it and whatnot, definitely. Anything else you want to share that you're thinking about for the future?
Franchising. So over the next year or two, NUTRADRiP will be franchising and opening additional wellness centers throughout North Carolina. So that's something I'm really excited about.
Good for you. Were you linked back to the Small Business Center, or have you kind of
most definitely. Yep.
And maybe they can use you for their role model for future
I would
people.
love that. Yeah.
Let's see what we did. Well, congratulations again for being Small Business of the Month.
Thank you.
It's been delightful getting to know you.
It's a pleasure to meet you, and I enjoy speaking with you as well.
Thank you. Thank you for joining us. We'll see you again soon.
Thank you.